We acknowledge that Tri-Cities Community Television operates on the traditional, ancestral, and unceded territory of the Coquitlam First Nation. We thank the Coquitlam who continue to live on these lands and care for them along with the waters and all that is above and below.
Good evening, everyone. Welcome to our town hall event. My name is Ben Craig. I'm with the Maillardville Residents Association, and we co-sponsor tonight's event. Our group represents Maillardville here, approximately 6,000 homes around where you sit tonight. We were formed in 2005 with one goal, that's to make the community a better place to live. And I'm the president of the MRA. I'll extend a warm welcome to all of our friends and neighbors from the area. We also have Jason Chabot, our vice president, here tonight. Is Jason in the room? I think he's downstairs fixing the tech, but Jason's our vice president. We're here tonight to strengthen our membership and our board, so as you're listening to the upcoming presentations, please consider becoming a member and or getting on the board. Membership fees are $15, and it's a lifetime membership, so there's no renewals. Now, membership fees fund our operations. Obviously, we organize events like tonight, where we bring the community together with local leaders and decision makers. But we also put out a newsletter a couple of times a year. We do a monthly litter pickup around the neighborhood. We have a proud history of providing an annual bursary to a lucky Coquitlam student. Membership, thank you. Membership gets you on our email list, which will keep you on top with all the developments here in Maillardville. So please talk to myself or Jason, who will introduce it again later if you're interested in following up on that. Now, we have a proud partner here tonight, and their name is the Town Hall Project. And they have held a number of these events throughout the Lower Mainland, all very successful, as tonight's is shaping up. But this is a true grassroots effort. There's no shadowy operatives working in the background. Just a group of committed citizens looking to provide the public with information that falls outside of the mainstream narrative. It's not our goal to take a position on any of the issues tonight, but to serve as a platform, to bring people together. And I don't mean hiding behind our keyboards on social media. I mean looking each other in the eyes. It seems like today's citizenry is more divided than ever. These events are meant to serve as an opposing force to that division. Personally, I'm proud to play a small part in this effort because there's only one goal here, and that is to bring our community together and create a more informed citizenry. Tonight is 100% citizen funded, so we do have a donation table at the back to cover our costs of the event. But beyond that, tonight's organizers have committed a tremendous amount of time and energy to this effort. So let's give a warm applause to our volunteers. So we have a lot to cover tonight. The agenda will go basically as follows. Our speaker presentations will be about 15 minutes long. And we have a tremendous panel of 5 speakers tonight. After we hear from our 5 speakers, we're going to have a panel discussion. Panel discussions are fun. And we're going to get our audience involved, okay? So we're going to come to your questions in 2 ways. First, we're going to use Slido, okay? Now this is software designed to organize our questions and allow people to vote on the best questions. And you don't have to download anything or sign up for anything. Just go to slido.com, slido.com, and we'll show the code a little bit later and you can answer your questions. We're also going to provide a mic for people who want to voice their questions, but this is important for both methods, Slido or the mic. We'll ask you to direct your questions to one of our speakers, okay? So we've got 5 tremendous speakers tonight. Address your questions to one. Make sure you're thinking about those questions as you listen to our speakers. So that's it for me for the moment. And we should have everybody done by about 8, maybe a little after 8 o'clock tonight. And with that, I'm happy to introduce our first speaker. Now, we had Mayor Brad West scheduled tonight. Unfortunately, he had to cancel a few days ago due to a personal issue, but we are so grateful to have Dr. Julian Somers here tonight. Dr. Somers is a professor in the Health Sciences Division at Simon Fraser University. His areas of research include clinical psychology, substance use, and mental health, primary healthcare reform, and homelessness. Dr. Somers is here to speak about improving clinical practices and public policies related to addiction and mental health. Please give a warm welcome, a warm Maillardville welcome to Dr. Somers.
Thank you, Ben, and thanks everybody for the opportunity to share with you some remarks, and then I'm looking forward to the Q&A a bit later. So I started my clinical career not far from here at Riverview Hospital in 1986, and since that time I've been working exclusively in the area of addiction, addiction policies, and addiction spills over, so as Ben mentioned, it spills over into the criminal justice realm, into homelessness, into additional forms of mental illness or psychological suffering as a kind of a cluster. And that's really where I focus. So I led provincial units at UBC for about 10 years, which was partnered with the BC government to try to move forward essential interdepartmental, interagency forms of collaboration that are part of what's needed. And more recently, the last 15 years, I've been leading a similar unit at SFU, but with the same focus. I've got 3 main points I want to emphasize and leave you with that I think are grounds for tremendous optimism. One is that we collectively have available to us outstanding evidence regarding things that help people, help prevent problems, severe problems from emerging, but also that help people who are experiencing the most severe problems get out of that state and into much better places. The second is that in BC, we have some of the world's most effective, most useful information monitoring systems. This is partly because we have a single payer responsible for all of the things that are important, income assistance, employment, but also health services, almost all health services, and all correctional services, all centralized. That's actually just not the case in very many jurisdictions outside Canada. Related to that second point, and this is my third point, we have very precise knowledge about where in BC problems related to severe addiction are most heavily concentrated, and we know what happens to people in those settings when services are insufficient. And to cut to the chase, they move. So one of the themes that influences, so I'll now go back through my 3 points about what do we know that works. The main thing that we know that helps people escape severe addictions, the kinds of addictions that have become increasingly prevalent in BC, addictions visibly connected to encampments, visibly connected to rises in crime, which is accurate. Addiction has become increasingly intertwined crime in BC over the last 10 years, not before that. One of the themes that helps people the most is having an overarching focus on promoting social reintegration. The Portuguese national strategy, Portugal gets a lot of correct attention. I've written about Portugal's experience and the turnaround that they achieved between 2000 and 2010. It's important to know that they subsequently changed their approach out of necessity. But between that period of time, their national strategy, it's available online in English, and it states, it's a long document, but it states very clearly, and this is the quote, "Strictly speaking, there is no such thing as addiction treatment without social reintegration. So as part of their approach, they famously did things, probably most famously, but perhaps not that important, they decriminalized the possession of drugs. It was not a particularly important element of their strategy. Elements that were very important were implementing what were called dissuasion commissions. These are places that are basically meant to support people and establish the beginning steps towards social reintegration. They implemented in that 10-year period 63 therapeutic communities. This is a place where people who are basically, starting from scratch almost on this social reintegration journey could go, learn and live with others, and importantly, gain skills that would make them more likely to be gainfully employed when they left a therapeutic community. So Portugal implemented 63 therapeutic communities and not a single drug consumption site. Now, in BC, in the face of our crisis, almost 20 years later, we chose to implement no therapeutic communities or anything like them, and now 58 drug consumption sites in our province. Just to give you a sense of the sort of the starkness of the difference in the way that we've gone about essentially disregarding social reintegration as a goal. Now, it's not only Portugal. When I was working at Riverview, even in the mid and late 80s, we were already deinstitutionalizing, closing, and we were not alone. This was happening around the world. That was not done simply on a whim, simultaneously everywhere. We had evidence then that it was better for people that would otherwise be institutionalized if we supported them in their home communities. We knew that it was viable to do that, and essentially we were pursuing this goal of social reintegration or social integration, maintaining people and the human contacts that basically amount for most of what values in all of our lives. Jobs, access to other things in the community settings. So this overarching theme of social integration was part of what I was initially brought into, and it's part of what I was at the heart of what we were promoting through the work that I alluded to at UBC and at SFU with the provincial government, and it touched down in concrete places like drug treatment court. So drug treatment court operating in downtown Vancouver and in other places receives people who have been repeatedly brought by police to court, where an addiction is a key driver of what's keeping them stuck in the cycle. The drug treatment court is effective, and we've written several papers on drug treatment court, on community court, and other justice interventions. They're successful because they have resources that allow people to relocate to healthy settings, healthy communities, with the supports necessary to make sure that that transition is effective. That concurrently separates them from many of the environmental influences, including other drug users, other people involved in lives that are supported by crimes of survival. And it separates them from those influences so that they have the opportunity to reconnect with employment, which is one of the criteria for success in drug treatment court and community court. And most people who choose it are successful. Now, we also had the opportunity, this is with the largest project that I was responsible for, took the same intervention and provided it to people voluntarily. So we recruited 500 people who were deemed the hardest to house, the least likely to receive services in the downtown east side. We randomly assigned them to either treatment as usual, so whatever was going on, and to two interventions that we designed. One was housing people all together in a building, about 107 residents, with a very rich complement of resources in the building. And the other was offering people choices of housing dispersed through communities in Metro with a 24/7 team that provided them with support where they lived, wherever they chose to live. Hands down, the group that received the choices of housing and the scattered interventions had by far the most successful outcomes. Not only subjectively, saying, I feel like a new person, I feel as though I'm being treated as a real human for the first time, but they had 71% fewer criminal convictions in the very next year compared to usual care, and 45% fewer medical emergencies, as well as being happier. the people that were housed in the congregate building, even though they had the same richness of supports in the building, had no difference in terms of crime or medical emergencies than the people who remained homeless. And what we saw was that the culture of the building essentially was shaped by the culture of the street. We simply moved it indoors. There was no opportunity for those individuals to change. So myself and other colleagues doing this work, we already knew that what we were trying to put on display was what we were supposed to do and what many countries did following deinstitutionalization. Some places, Scandinavian countries did a particularly good job. Portugal belatedly did a very good job for historical, understandable reasons coming out from under a dictatorship. And today in Canada, Alberta is leading sort of the way, also belatedly implementing this model and making it normative. And it takes a huge, huge amount of work. For many years, for most of my career, I was also on very good terms, working closely with people in BC. And it's always been my belief that British Columbians should be the first people to benefit from the kinds of things that we've shown to be effective in BC. That, unfortunately, tragically, has not been the case in the last few years. And we've come through an era where I know this is a nonpartisan forum, and I want to respect that. My critique of the BC government is not actually partisan. Leaders of different parties have done work that warrants criticism in hindsight. The mainstay that I think is more responsible, and who I used to work very closely with, so I have some confidence in sharing this with you, the main source of some of our recent troubles has been a feeling of certainty without evidence of support among people who are public servants. And so we have not implemented, that's putting it mildly to say that we haven't implemented what we could be doing and what has the strongest evidence of success. It's putting it mildly because, if anything, some of that evidence was deliberately distanced from decision making. We, rather than continuing to build on the information systems that made us really in a privileged position to identify where people are having problems around the province, that was scrapped and eliminated. And with that, we turned away from the already published knowledge of where in BC communities are there heavy concentrations of people suffering, often in settings that have no resources, and having shown that the people in those communities, as a result of that, move in particular to the downtown east side. Of the 500 people that we worked with, if you go back 10 years earlier when those people first began experiencing homelessness, involvement with crime, hospitalization, and those things, 85% were not in the metro region. They came from other places. And but we distance ourselves from that knowledge too, because what we've done instead has been to implement low barrier congregate housing in urban settings. We went from 1 to 58 consumption sites, and we've been focusing on trying to achieve gains by changing in some ways the supply of drugs. Well, everything that we know that helps people overcome addictions and make major changes doesn't involve the supply of drugs. It involves what you might refer to as the demand side of addiction. What are the competing priorities? What are the competing motivations that for most of us in this room are how I would explain why most of us are not currently somewhere else smoking fentanyl? We have more important things to do, literally. We have purpose and meaning, and when people overcome addictions, that's what they say about their situation too. Connection, hope, a renewed sense of identity, motivation for the future, and empowerment. CHIME is a well-developed academic acronym now. So, and if there's one thing that we should have learned from the war on drugs, it's that you can focus all you want on trying to change the supply of drugs, and that's likely going to be insufficient to achieve meaningful changes in a local addiction crisis. So we have the capabilities to measure where things are going difficultly for people. We have the ability to measure improvements related to our services and compare them against benchmarks. 71% reduction in crime, 45% reduction in medical emergencies. Choose your benchmark. We can do that. We can identify where problems are, and we can develop services that have standards. None of the services that are currently relied upon by people with addictions conform to any kinds of standards around BC. That's simply shameful. All of these changes are possible. Up until about 5 or 6 years ago, I thought that that was the path that we had been pursuing. And so we've gone through what is, for me, and for, of course, many, many people, an excruciatingly difficult phase. But we can get back to a much more rational and effective approach to preventing problems in the first place, but helping people once they enter into crisis. And the key thing, in my view, is not necessarily which party we elect or which leaders we elect. The key thing is whether the leaders that we elect are prepared to change the public service in ways that will deliver those improved results. For many years, or not for many years, I'd say actually, for a few weeks, I was very hopeful that that person could be Mr. Eby. It's proven not to be the case. Right? But my issues, my points, again, are not partisan. My points are, and my call to you would be to please scrutinize people who are wanting to earn your vote, and on this issue, consider whether they appear poised to make the necessary changes to the public service that would then result in improvement. Otherwise, nothing, in my view, nothing much will change. So, thank you. I'll conclude there.